Hello, everyone. So good to see you. Joining us for another webinar that we have. This week we have the incredible Dr. Sheila Alton. But before we get into all that, we'll give people just a few moments to arrive and stuff. So we have a poll that we'll put up here, and it may take me a second to do this, but how did we were just talking beforehand with each other on whether we were able to enjoy the beautiful day today.
It was so nice. Went on a little walk.
It was beautiful. Judah and I, like I said, we went on a bike ride and enjoyed a forest that we found along the way, which was just a few, there's brush and saplings and stuff, and it was fun.
Yeah, that's so cute.
Well, here's the poll. So everybody jump on and answer this question. How soon after is it showing it right now?
Yeah, I see it.
Okay, good. I don't get quite the same screen, so I always check with you guys. But how soon after restrictions are lifted do you plan to resume normal activities other than job responsibility? So go ahead and do that. And we'll see everybody's response. We're getting some already.
Good.
It's always interesting to see the results. We'll show them here in just a minute.
Good job, Southwoods people. So many people on.
Yeah. Have you guys been able to check into the live stream every week?
Yeah, we have. Yeah. I have.
Cool. Down below, for everybody who's joining us, there is a chat feature. Feel free to go ahead and chat on there. We'd love to hear back from you. Whether if you at a later point, we're also going to have some question and answer time. So at any point, if you have any questions that Sheila can answer, feel free to type them in there, and we will we'll ask those to Sheila. But you can also on there just kind of use that for just discussion or anything else as well. There is handouts available as well. Sheila will go through some of that, but just wanted to make sure you guys knew some of the options of what we have there.
We have a shout out from the crowd. Hi, Mom, from Jenna Wilson.
Awesome. I can always count on Jenna.
Yeah. All right, we're going to go ahead and close this poll just to see what the response is that we had. And here's the results.
Oh.
Looks like
oh, wow.
43% are saying they want to get back to things immediately. And 14% said in a month or two. 24% said when doctors start saying there's less risk. And then 19% say not sure. Nobody said that they're going to wait for a vaccine.
There you go.
Because I do know that's going to take a while.
It's going to be a very long time. Yes.
Yeah. Very, very true. Well, awesome. Well, Sheila, thank you so much for being here. You are such a huge blessing to our church, to our community, so many others as well. So thank you for taking your time. I know that you are incredibly busy at this time. So we really appreciate that. And I know that there's a lot of people who have some questions regarding a lot of the different things that are going on right now. And what's cool is, I feel God has very uniquely equipped you for such a time as this. And so thank you for taking some time out to talk with us on that. We're going to start off though, because, who knows, maybe there's some people who don't know you that are tuning in. What I should have done is sent something to your daughters and found out some more information about you. That would have been really fun. We can always do that in the chat feature.
Yeah,
I guess.
chat us, guys.
we won't be that. We did want to ask you just a few questions before we got into some of our other discussion. What is it that you do, and how long have you been doing it?
Sure. I'm an emergency medicine physician, so that's a subspecialty that you obtain after your medical school. You do a separate residency for it. And so I finished my residency in 1994. So I completed 26 years of emergency medicine, practicing that in the community. Actually, July is when kind of started my full-time job that long ago, 26 years ago. So
Cool.
it's been quite a while.
Do you enjoy it?
Yes, I do. I do enjoy
I
it.
was gonna say
I do.
you'd have to. I think you would have to really enjoy it to kind of stay in with
That
what
one.
you're doing. What is it that you most enjoy about being an ER doctor?
I probably just enjoy the variety of it, and just it just, even though I've done it 26 years, I mean, it'll be, a shift where it's like, wow, I've never seen that before. So it's very few jobs, I think, that you can say that after 26 years.
Yeah,
And
except for ministry. Ministry, you can do that
that's
too.
Yeah.
mainly because you also deal in human behavior. So human behavior never seems to disappoint me, because some of the things people do and the resultant, injuries and things that happen are you could just never even think of something like that, So
Yeah.
some of them not so funny, but some of them honestly quite entertaining.
Oh,
So
I can imagine.
yes.
Some of my injuries that I've gone in for, a little humorous in and of themselves. So, you've been at Southwoods for a long time. You and your husband and your whole family have been very involved with everything. Could you tell us just a little bit about how long you've been at Southwoods, what kind of brought you to Southwoods, and I don't know, anything else that you would want to share?
Yeah, so my husband and I were at the Christian church, and were approached by a group, and met Greg and Lori because they were starting a new church and they needed some help. And we originally were with them like the year before, and we're doing the phone calling. I think Dolores mentioned that in her little interview that she did, Dolores Taylor. And so we're doing the phone calling, and then we decided to go and start that church with them. So I was a third-year medical student at the time, and we were engaged, and we started the church, of course, 30 years ago. And conveniently, we got married that June. So the good news is, every anniversary Sunday, Greg announces what our anniversary is going to be. So we
Yep.
never,
There you go.
so it's very helpful to do that. It's perfect timing. And I think, so now we never miss it. We always know what our anniversary is.
Helps Jeff out. He probably
Greg
needs
calls
that
it.
help.
Yeah.
Yeah.
So
I
it's
think
been,
Jeff actually
a
told
long
me that
time.
at
We've
one
done a
point.
little bit of everything there. So
Yeah, and it's on. I mean, it's on every decade. It's on was it 1990 when you guys got married? So
There you
that
go.
helps too. See, I'm 2007, so I have to do math every time. It's
yeah,
just
that's
not my
hard.
strong
That's
suit.
too much work.
You don't go to Christian college for a math degree. We'll
No.
put it that way. So, well, Sheila, thank you so much for your time. I know that you had a few things you were going to talk through, kind of on some of the current state of COVID and everything else that's going on, and we're kind of in this. What does the future look like? So I know you're going to address that as well as a few other things. So we'll just
Sure.
give you some time. Thank you so much.
Okay. Yes. Well, could I just give a brief update? Obviously, in our metropolitan area, we have been blessed in that we haven't had near the, obviously, the onslaught of disease burden that you see in all these big hot spots. There's about 10 cities and 10 areas in the country that really have been hit hard. Obviously, New York, everybody knows about. So I think we were fortunate in that when they did the shutdowns on the coast, we became the beneficiaries of that in the Midwest, because everything moves in from the coast. So I always knew we weren't going to really see that as much here. We don't have the big population base. We have more land. We're more spread out. And of course, we benefited from the shutdown. So that's been really helpful. So obviously we haven't seen that here near as much. Looking forward now, there's a lot of things people have been talking about. They've been talking about the testing. We do need to do more testing. Testing has been a little bit of an issue in our country, and that's something that probably we'll look back and say that was something that was a hurdle that we did not quite clear as effectively as we would have thought we would have. Antibody testing is starting to come out, and the thing with antibody testing is we don't know really what it means yet. So they're looking at you could do all your healthcare workers. So if we show that we have antibodies to it, then we have been exposed to it, even if we didn't have symptoms, but it doesn't really mean we're immune yet. So we don't know, like, is it just a transient immunity? Does it just work for 3 months? Does it work for a year? Do you get lifetime immunity? So those are things that aren't going to be answered until we actually go through probably a whole year of this disease to really find out. As far as one thing that we've seen that's kind of actually been a, I think, unfortunate side effect of this is that we did this messaging, and it was honestly so effective. I've never seen anything quite like this, obviously, in all my years of medicine. But we went out and told everybody that you really need to be careful coming in. You need to be, you know, using the emergency department appropriately. And it's literally shut down every emergency department across the country, except for just those hot spots. So it's like we all sat around and lamented, like, where did the heart attacks go? Where did the appendicitis go? What about all these people having strokes? Because that prevalence stays the same in our society. And it's like they just disappeared off the face of the earth. And what we found was that they were staying at home because they were so scared to come in, that they unfortunately were suffering, you know, worsening effects, disability, and even death from not seeking treatment. So the new message we need to get out is that do not delay your care, that it's safe to come in the hospital. It's probably the cleanest it's ever been, ever. Every single hospital in this country is immaculate. And so come on in, you got to be seen for your chest pain. You need to be seen for any stroke-like symptoms. Definitely access our 911 pre-hospital system. They're safe. They, again, constantly cleaning out those rigs. They're wearing appropriate PPE to protect you, to protect themselves. So it's one of those things where we want to utilize them because we're now seeing delay of care and a secondary effect of these untreated disease processes. So that's something that we need to get that message out going forward. The other thing too is that we talk about releasing the quarantine and what's going to happen. One thing will be we'll start opening up all of our elective procedures, all of our, basic preventative health measures that we do. You can start getting your mammograms and your colonoscopies, and you'll start being able to do some of these surgeries that people have been delaying. And you definitely still want to take advantage of that, because what you want to do is not delay preventative medicine, right? That then is going to increase, your risk of having some of these chronic illnesses that then make you more at risk, right, for some of these novel viruses like we've just seen with coronavirus. So we definitely want to stay ahead of that and stay persistent with that. And as a whole, we want to start, as our country, start looking more at preventative health and just thinking that way too in our mind. You did that survey, and actually I could have predicted that most people will go back to normal, because again, in the Midwest, we haven't really seen it like you see it in the other cities. So we don't really feel that crush of fear that, New York City, it's going to take a long time for them to get out and walk around, I believe, and to get in a group, because it's really a different situation there than what it is here. You can't even compare the two. So I think it's just like with anything, people are going to have to do a risk, benefit assessment, just like we do with anything we do. So you have to decide what is your risk that you're willing to take for the benefit you're going to get from whatever activity that is. And I think by and large, as you have to look at it as believers, I think, you should be very comfortable with your own mortality. You should feel comfortable with that, because it's going to come after. I will tell you, we've had some very interesting conversations at work because of this, because a lot of people are very fearful, and they're, staying away from the family. They're moving into the basement. A couple people were going to go stay in a hotel because they're worried about taking it home to their family. And those are valid concerns, but I think as believers, you also know that this isn't all there is to our life, right? So we were made for a better place. We were made to be, walking with God in communion with Him. So I think that fear factor it certainly was not an issue for me. So I think those are things that you internally have to start looking at to tell yourself, what is your risk? How comfortable are you with your own mortality? And you need to look at it in light of your spiritual faith journey and how you feel comfortable with that. I've done some really crazy things that people thought are just insane. I went to Bosnia during the war and spent a month there working in an ER. And I, been to Haiti multiple times in situations that were, kind of dicey. But the one thing I won't do is go roller skating, because I don't want to fall and break my wrist, because that puts me in a position where I can't work and serve as I feel God has, fit me. So again, these are risk benefit and, analyses that we do all the time. And I think you have to decide that for yourself, and your family has to decide that. I think also what you need to look at is our new normal is going to be getting healthy. I think we need to start wrapping our mind around that. And here's why. Pandemics historically that we have seen, and if you go back to the 1918 pandemic, you look at the 2009 H1N1, the swine flu pandemic, they start in the spring and you'll get a bump. Then I'm talking about the Northern Hemisphere for us. Then they kind of go away in the winter because the humidity and the heat do dampen it. And then they come back in the fall and the winter next with a vengeance. So I think we need to be prepared that this fall and winter is probably really going to be what we were thinking we were going to receive now. I think we're going to get that kind of volume this fall and winter. And I distinctively remember the 2001 pandemic, the swine flu one. And I'm sure maybe some of you did because we actually closed the schools for a couple of weeks, which was unheard of even then. And I remember the hospital being full. I remember we were running out of ventilators. I remember we were getting them from the strategic stockpile. Every hospital was overflowing. I saw 50 patients myself personally every shift. It still burns a memory in me that I just, I still remember to this day. So that was then with just that epidemic. You can't even imagine what will happen with regular influenza and then add the coronavirus on top. So I think we need to prepare for that. And we've been given this grace period to kind of sit down and tell ourselves, okay, what are we going to do about it? Okay. I think a couple things are, we need to look at our chronic, disease burden as a society. We have a very high chronic disease burden. So you need to ask yourself, where am I at right now? Are there things I can do if I'm pretty healthy? Are there things I can do to keep myself healthy and then prevent the onslaught of these chronic health diseases? If I'm already exhibiting some of them, experiencing some of them, what are some things I could do to improve my current condition? And those are things, again, that there's a lot of resources out there to use. I kind of think personally, as a society, we've gotten lax, and we've gotten lax because we have this healthcare system that we can access that kind of just puts Humpty Dumpty back together again pretty effectively and frequently. And so as a whole, I think we decided, I can just take a cholesterol medicine for that, or I can take my blood pressure medicine for that, or if I get my heart attack, I can go in and they'll do the balloon procedure, and you're literally out of the hospital in 36 hours and you're back doing your normal daily work. And we got lulled into a false sense of we could almost manage everything with using, reaction to it, like reactive medicine, not preventative medicine. So I think now it's kind of our wake-up call. We need to get back to being preventative and back to saying, what can we do individually and what can we utilize that we know about in healthcare to really make ourselves as healthy as we can be. So I'm looking forward, I was trying to just think of some really simple things to do, because again, we have this grace period, we have the whole summer in front of us, and we need to kind of get ourselves ready so that when winter comes, and it will, we're going to be hit with these, combined forces. We're more prepared as a whole, and we're more prepared even here locally. And I think one thing would be, and it sounds so stupid, we keep saying this over and over and over again, is get the flu vaccine. And again, it's one of those things where, because people are clamoring for the coronavirus vaccine, and yet they don't take advantage of the vaccines we already have. So it's not even just the flu vaccine, but we're noticing because of this kind of shutdown, even children have not been getting their usual vaccines. And you have to also pay attention as an adult, because, pertussis still comes around. We still see pertussis. So an MMR, sometimes you need a booster. So these are things that when you're going in for your preventative health, you ask them, what are the vaccines I need to be getting? Do I need to check some titers to make sure I have a good response? And do I need to get a booster? Because what you'll find is, if you can dampen all those other, illnesses that we actually do have very effective vaccines for, that'll help us overall. We just started seeing measles flare up quite significantly in our country last year, and that's very, very concerning. And what we don't want to start seeing are all the other ones come up, another pertussis outbreak, polio, things like that, that some people have never even heard of here. They will come back if we're not vigilant. So the first thing is, check all your vaccinations, get the flu vaccine, that'll help tremendously. And then another thing is just increasing our physical activity. I think now that we've been cooped up so much, that's almost been like a natural byproduct, because everyone's just so desperate to get out. Thankfully, here locally, we're able to get out. Some cities have not been, so tolerant of that. But we've been able to get out and really enjoy just walking outside, and that, sitting is considered the new smoking. So if you really want to look at, changing up some things, get out there, get moving. It's been very helpful for not just physical, but mental health as well. Being out in the environment is also very helpful. It kind of heightens all your, your senses. You're smelling different things, you're listening to different things, you're seeing different things, even touching, and feeling the wind or touching a flower. So all those things actually really do work all together to help with your overall health. And then we looked at some things, just like I've been doing this about the past year. How can I boost my overall immunity, my overall health? And then as a group of doctors, we all decided to take some of these things ourselves. And this is by no way an endorsement. You can, obviously find all this on the internet, as on information, but a couple of things that have kind of come to light is vitamin D. Vitamin D has been shown to be, like, we're chronically deprived of it in our country. Levels have never really been as low as they are right now, and people with very low vitamin D do not fare well with respiratory illnesses. So, and part of that is because we've been so effective at conveying the message that sun exposure gives you skin cancer, which it does. So in light of the fact that we're trying to avoid the sun exposure, our body makes vitamin D from our skin, and you have to have UV light to make it. So if you're not, if we're not doing that, then what we need to do is take it. And you can either take it dietary, but if you're not going to get enough in through your diet, then you need to take a supplement. So that's one thing that we've all been doing, is boosting our vitamin D. Vitamin C and zinc, again, those have long been touted for respiratory illnesses. But the problem is you don't want to wait till you're sick and then you take that little pack and you drink it down. That's really not doing anything. These are all little building blocks that your cells need to have, and they need to have. It's kind of like looking at the grocery stores. When everything's stocked, it's all ready to go. When you're down to that last roll of toilet paper, it really is not helping everybody. So you really want to have all those things sitting there ready to go, have them there, build them up in your body. It takes months to really get a normal, level of all these things. So that's a good thing to start now. And then there's been a lot of talk with quercetin and elderberry and how those work against viruses. Quercetin also has like an anti-aging kind of component to it. You can find that in your diet. They're actually in a lot of vegetables. Again, though, I don't know how much you have to consume of those in order to get, what we would consider to be a daily dose. So again, you can take a supplement. All these things are, readily available. You can also find out what foods they're in and just take them in naturally that way. But these are just some things I think we look at right now. We can start getting ourselves healthy for the winter. And the last thing I would say is also look and have these discussions with your family, especially those that are older, on just getting your legal affairs in order. What I mean by that is, we have this thing called healthcare directive and power of attorney. And when people come in distress, which has been a hallmark of this disease, all of a sudden you have to make some of these decisions, and you just don't have time to do it in that emergency. You're not going to be able to Zoom with all your siblings and make a decision about grandma or what we're going to do. That has to be talked about, and those things have to be put on paper before all this happens. So these are things, again, you could be doing now, especially if you're in the age group that this could be a reality for you, and you need to make some decisions like that. And then the last thing would be just getting like medication lists and your medical history. Again, having that readily available. It is, I would say, 8 out of 10 times I don't have a medication list. And I'll find out people are on very significant medications, and there's just no way I can access this information. And this is one of those things, again, when you're in a pandemic, we're not gonna have time to go searching for a lot of this stuff. And a lot of these places are closed, and Walgreens are closed, and we can't just call them up. So these are things, again, that are just common sense. But it really shows the deficiency when we're in this kind of scenario where healthcare systems get overwhelmed, and then suddenly simple things, when we don't even have access to those, really make a difference in how we can effectively treat people. So those would be things I'd say we can actually do right now, do them all over the summer, get everything set in place, and then we'll be better, prepared for the winter.
Thank you very much, Sheila. I really appreciate that. Here, my camera's back up finally. Okay. So thank you so much. That man, that was a lot of good information for me. I know that part of the thing is, you hear all this stuff on the news and on the media, and it's like you don't know, everybody kind of has a bent, maybe is the way I would say it. There's some sort of bents this way or that. And just to hear from somebody I know and trust, I mean, that's just huge for me at least. So thank you. And plus, you know, you're local and you know our area better than people in Washington, D.C. or anywhere else that people talk about. So thank you so much for that. We do have some questions that have come in. I know Kristen has one that she can ask you there.
Yeah, I do see one. One is pretty much just saying like, sorry. As a Christian physician and a church attendee, what is your comfort level of getting back together? And should there be a phase in regardless of church size? And so the idea is just like some churches are following the rules and some are not. You know, some are claiming like we shouldn't be faithless, we should be, you know, fearless and all of that. So I guess, yeah, good question. Should
Sure.
there be a phase in regardless of church size?
Yeah, that's very interesting. I think you have to look at it in context of initially when this order came out, nobody had any idea how the coronavirus is going to affect our country. We were assuming the absolute worst from the beginning. Okay. I mean, again, never in my career have I ever heard of canceling outpatient surgery. It just never happened. And I don't think it ever did. And now, you know, this is one of those kind of like moments where you saw things get canceled. You never in a million years would think it would get canceled in anticipation for this. So I think in the beginning it was wise because we didn't know how it was going to spread here locally and how we were going to have it. And I think it would have been considered, how should I say it, maybe slightly irresponsible as just an overall citizen. You have to look at yourself as just a citizen of the county and, you know, how are you responding here locally? And I think it was the wise thing to do what we did because it just showed that you were trying in good faith to follow guidelines that were based on extremely limited information. And you just had to kind of go with that, okay? And I don't think and it shouldn't have suffered. I mean, if your spiritual walk suffered because of that, then I guess we now need to peel that back and look at our spiritual life, right? Because as we well know, the building is not the church. So I do believe that that was a correct following at that time. Now you can start to look at coming back. And like I said, it's one of those things where, again, it's going to be your own personal risk assessment, right? So if you're in a high risk group and you're very uncomfortable with that, then we do have an option, which is live stream, right? And I think you're going to start seeing that happen more and more. I think you're going to start seeing, you know, 9/11 changed everything, right? I mean, we never had travel again like we had before. So I think this is going to change everything. And I think we're going to see maybe some events just aren't going to be the same. You know, I think people are going to feel uncomfortable with it. They're going to, you know, start seeing live stream events for high school concerts and, you know, all sorts of different things that you never would have thought of before because individual people's comfort level is going to be different. So I think that's something that we're going to have to just take, and you can't really judge someone else's comfort level on that. And I don't think you should. Okay. Again, I went to a war zone. Most people would think that was insane. So, you know, you can't really judge it and you can't determine that for them. Everyone has to determine that for themselves. But I think people are willing to get back into it knowing that overall in our population, we don't have a high disease burden. That may change come this winter. See, that may be a different story. If it really comes with influenza and it's, you know, really, really bad, we may have to take another look at that. And the government will probably do that for us, you know, and maybe they're going to decide that large group gatherings become a nidus for this infection and spread, and we have to kind of clamp that down just to try to limit the overall spread in the community. So I think you're just going to have to take that really kind of one step at a time.
I know you had mentioned earlier before we had started the webinar here, just some of the guidelines as far as what they use to be able to determine reopening process and stuff. Did you want to talk more on that at all?
Oh, like with the health department survey?
Yeah.
Yeah. So it closes, it's up through tomorrow. So people need to get on it tonight. If you're a Johnson County resident, if you go to Johnson County Health Department website, just type in Johnson County Health Department, it says Population Health Survey. And people that might have been getting these already through your Nextdoor app. And this is part of what they're talking about. And you probably heard it even, I think, today's briefing, they were talking about this surveillance team that's going to be going across the country, that's going to be looking at tracking epidemiologically how this is, you know, tracking known positives, and then they call it contact sourcing. and who they had contact with. Well, this is a really easy way that's not invasive. They're not going off your cell phone data, and you're just voluntarily, anonymously giving them some basic information about your household on symptoms. So they use this kind of data to decide, maybe, we don't have that much in our county. We're safe to open up more. If they start seeing, I have a feeling they're going to be putting these out there more and more. So the reason why I say get on there now, because if you put your email in, you'll get the next one. And this is very helpful for our local public health department to track a lot of this. Again, it's not being weird. It's not putting a drone over your house. It's not tracking your cell phone. It's just some basic anonymous data that will help them make some of these decisions and make them with more data. That's part of our problem. You make some of these things, you're literally guessing. So I think it's just, again, kind of a helpful tool, and I would look for more of those.
Where, as far as Kansas in and of itself, I've seen, it seems like it's been a few more recently. Where are we kind of at in the process of COVID? I mean, I still see that there's definitely some coming in.
Yeah, there is, but I just checked, like today we had 396 total in Johnson County with 36 deaths. The Kansas City, Jackson County, Kansas City was 736 with 25 deaths. So part of that is, again, that's an urban area and you have more people in that area. A lot of the problem has been in the nursing homes, and that's been a huge issue. And those numbers, I don't even think have been counted in a lot of the nationwide data. And that's kind of like in the Wyandotte County numbers, most of those were in that one nursing home facility. So I think you're going to see a lot more of those, start to come up. And I think, there's going to be a change. There's already been changes. There's going to be some regulatory changes involved in these long-term care facilities and nursing homes because they're really close knit, but you got people in very high risk groups. So there's going to be some changes going to have to happen there just across the board. And it's not just in our country, it's in other countries too that have the same type of care, like United Kingdom. They're seeing the same thing. So those are the kind of things that, again, we're probably pretty much at peak. This was supposed to be, last week and this week were supposed to be our peak here locally.
Okay.
Another question is, random testing is prominent right now. Does that really give a good overall barometer or just for that day? Couldn't someone test negative one day and be infected the next?
Yeah, well, here's the whole issue with testing. The testing is not 100% sensitive. So you could have a negative test, but you could actually still be positive, okay? Because part of the problem with the testing is just the sampling of it. We're only testing it in your nasopharyngeal airway like we do the flu swab, which is very uncomfortable. And if you don't do it correctly, you will get a false negative every single time. So it's difficult to even test it correctly. And then it's also assuming the disease enters your nasopharyngeal tract and then it moves to your lower respiratory tract. So you could catch it in the window where it's left your upper respiratory, moved to your lower respiratory. You're going to test negative. It's in there. And we're just not, going down and digging it out of people's lungs here. So that's the problem. We've had a lot of patients that I know 100% were COVID patients. They just fit it classically, but their test was negative. So nobody even knows what to do with all this yet. And that's part of the problem, is that we really don't have an effective test that's really sensitive, that you can sample easily and consistently in everybody. So we're really going off of, the syndrome that we're seeing more so.
We over and over on the front end of this, we kept hearing flatten the curve, and that the same amount of people would get infected, but it would just be spaced over a period of time. Is that still kind of what it looks like? That, I mean, you were mentioning this fall, kind of ramping up again. It's kind of what it sounds like is overall that's the case, but we're just trying to flatten it till we can get a vaccine.
Eventually, everyone will get it. I mean, I would be shocked if someone didn't get it. Now again, you may have an asymptomatic case of it, but it is very, highly contagious. So at some point, you're going to get, just like chickenpox. Everyone got chickenpox in my generation. I don't even know anyone who escaped it at that time. So it's going to be one of those things where we're just trying to spread that out, because as we saw in New York, to get it all at once is just inconceivable, and no healthcare system in the entire world could handle that. No one could. So we're trying to make it more of a, manageable, like instead of drinking out of the fire hose, we're drinking out of the faucet. So we're still going to see it. All these things that we've been doing in our policies and procedures. You know, I tell everyone at work, hey, we're lucky because we can practice at a pace that's manageable and we can get all these procedures down. And then we need to take advantage of that because it will hit us much more so in the fall and winter, and we won't have the luxury of time then. So, you know, all these things we're putting in place now, we don't want to let up on them. You know, you want to be vigilant, you want to be keeping clean, you want, you know, again, it kind of boggles your mind that like apparently nobody cleaned at the grocery stores before, because now everyone's cleaning nonstop, you know. So all this kind of stuff that's happening will continue, and we will continue it. Will we all wear masks like in Asia? That's a very interesting thought. Asia wears it because you have to remember, this isn't their first rodeo. You know, they had the original SARS, and it was way more, it was at a much higher fatality rate than this SARS. And they got stuck with that one too. And that gave them a huge panic when this one started, because they knew that what was coming down the pike. We really haven't had to suffer any of those. So if you look at the neighboring countries, and the reason why Hong Kong got everything out and going that fast was because they've been there and, you know, done that, and they knew how bad it was. So, you know, you can understand it more now, why they're like that and why they wear a mask all the time, because they live like coronavirus all the time, you know. And now over here, I can see certainly in the big cities, when you have that many people just all around you all the time, I can see that becoming the norm, where people just get out there when they're walking down New York City with other 800 people with you, you're wearing a mask.
Jenna Wilson has a question.
In Manhattan, Kansas, we have had more younger people test positive, or she says in Riley County, more younger people test positive for the virus than older people. Do you think the original statement of older people being more high risk is still true? Or what are your thoughts on younger people not thinking they can't get the virus?
What they mean by high risk, they mean high risk of the severe disease and dying. Everyone has the same risk of actually catching it, okay? And young people do catch it, and young people probably have had it for a while and didn't even realize it, especially the pediatric population, because we have seen that it really hasn't affected them at all like it affects, you know, the adult population. So it affects everyone the same, probably because Riley County is geared more towards a younger population because of the universities. So that's why your numbers are going to be more in the younger age group. But still, the people who, this has been very well played out here in our country. The ones who die are the ones who are older by a long shot. You will have young people in there, but those will be really random. It is still a huge proportion are the older population by far.
Do you think college and schools will need to be online in the fall?
That's going to be very interesting. I think that I think for your younger, you know, your elementary and your, you know, our elementary programs and non-college, just put that pre-college programs, it's very hard to do online. I think we can see that. I think everyone can conclude that it's just pretty much been a waste this last part of the school year, because elementary kids really, it's difficult for them to learn online, and when we don't really have, you know, a good internet program for all those kids who maybe had some disparity in that. So I would find that I would be shocked if they allowed them to stay home and do internet again. I think they'll put some things in place, you know, where kids are spread a little bit more apart instead of all clustered together. I think they're going to be washing their hands like incessantly. But again, we have to remember they are the group that may carry it, but they don't really get ill. H1N1 was a different story when we had it. Those children were dying at a huge rate. So it's a little bit different situation. And I think what'll happen is, again, they'll have to be cognizant of, if you have high risk individuals in your family and you're worried about that, then you got to keep the young'uns away from them for a little bit.
I know that we have we have some more questions, but before we get to that, I just wanted to remind everybody that we do have a handout that if you would like to see that, that's available in our handout section. Kristen has another question here, and then we'll do a poll here in a bit, and feel free to continue to ask questions as well.
Can you explain herd immunity? Good, bad?
Okay, yeah. Okay, well, herd immunity means did you have to have a certain percent of your population or your herd, right, of your group have that immunity in order for it to be effective for everybody. So all vaccines that we have are based on herd immunity. So when we vaccinate, like for polio, if you don't, and it has to be like 90% to have herd immunity. It's a very high number. That for people who can't take the vaccines, because there are individuals who can't have certain vaccines, the majority of people who then have the immunity protect everybody. So the whole concept of vaccinations, I think, is very altruistic. If you think about vaccines, you think about it's the one thing you're doing really not so much for yourself, you're doing it for everybody else. Because most people in their mind will tell you, oh, I'll be fine. I won't have any problems. I don't get that sick from the flu. I don't get that sick from this. I could handle it just fine. And they're missing the whole point. The point of getting the vaccine is for the other people who can't. Like, I look at your son, Cody. He probably is not going to be able to get a lot of those vaccines. I don't know. They might have a little bit of problem with them. All I know is there's certain individuals who can't. You do it for those people. That's who you do it for. Ironically, yes, you will benefit from it tremendously. But if you have a problem with assuming that you're not invincible, then the best way to think of it is you're doing it for other people.
We have, I'm going to put up a poll really quick, and feel free to continue to ask questions as I do that. But I thought this kind of, Dr. Sheila mentioned this earlier, and it kind of goes along with what you had earlier. What is, let me see, I lost it. Somebody else can read it because I can't see it. But
how would you evaluate your overall health?
Yes.
So you're either very healthy, you're fine, I'm good, I don't need to do anything else. I'm moderately healthy, but I could use some work, or I'm very poor health and I'm concerned about my susceptibility.
Awesome, thanks. My screen just, I lost that somehow, so thank you for reading that. So feel free to go ahead and put in any more questions. I mean, we're over on time, but we kind of planned a little bit on that. At any point, feel free, if you need to leave, just know that, you know, you can leave if you're following us right now. But we just kind of wanted to create a little bit longer time of some question and answer, if any of you had any questions here. And you were saying that, you know, one of the big things was that just poor health can make you really susceptible. And so that's one of the big concerns going forward, is just that poor health, that not non-preventative measures, that you're just kind of not taking all those things that you can to prevent yourself from getting some of this, or at least having the ability to fight it better.
Yes, and it's interesting because this virus is different from our prior pandemics, and that, like I said, I mentioned H1N1 actually affected young people, and tragically, there are a lot of pediatric deaths with H1N1. The famous Spanish flu actually also affected the young people, and it was because more of the immune response you saw with it. And so, ironically, the very old and the super young who don't have a really robust immune system survived the Spanish flu, and it took out the very population, you know, of the, you know, mid-teens to your 40s. And those are the people, of course, who are working, who are, you know, parents. And so it was a very interesting phenomenon with that one. And it probably was more devastating because of that reason. This one is just what's causing more of a healthcare burden, is what this one's causing, because you'll have people on dialysis, you have people who, you know, already have chronic heart disease, and then you put this on top of it, and it ends up being a huge kind of tax on our healthcare system, the way we have it set up today. So it's a little bit different population that this pandemic is affecting. And so I think that's part of the issue with the healthcare system right now.
Mm-hmm. I'll go, when I close the poll, I'm going to go ahead and share it now so everybody can see. Most people feel like they're very healthy. They're good. 32% says moderately healthy, definitely could use some work. And 4% said I really need to get myself in line to just kind of help out with some of that. So.
And I would suspect that because Johnson County as a whole is a very, as a population base that's very healthy and very cognizant of their health, you know, so that reflects really our population base.
Mm-hmm. Kristen, was there some more questions that you'd like?
Yes. Can you answer the question, Cody? Will you have a playback available?
There will be a playback available. Yes, we will. we'll in the next couple days we'll try to get it all wrapped up, and we'll post that, and we can send that out. I guess we can send it out via email, church email. If you are not connected to our church email, you can contact the church, and we'd be happy to send it to you. We'll have it on YouTube. So we'll just, if you have any questions, you want to access it, please contact the church, and we'll let you know how to access it.
Mhm. And lots of people are saying thank you, and we are so blessed to have you, Sheila.
Well,
That
I'm
is for sure.
certainly blessed by our church, so.
Very good. Well, thank you so much for your time. We really appreciate everything that you shared with us today, and yeah, just thank you so much. I don't know what else to say really, but
Yeah.
you're a blessing, and we are thankful for your ministry. It is a ministry. So thank you so much for doing that for all of us.
Sure. Well, stay healthy.
I'll do my best.
Wash your hands,
All right.
guys.
All right.
Bye.
See y'all later. All right. Bye.